let me do this. Great. So that when y'all see that it is 7 o'clock on a Thursday, you'd be like, oh, right. It's NCLEX Jeopardy time. Because that's exactly what it is. What's up, what's up, what's up? I keep wanting to call Thursdays hump day, and that's not accurate. I've got to stop. Happy Thursday, guys. Happy Thursday. How are you doing? And I think today's the last day of June, too, right? Is there a 31st in June? Is there a 31st in June? No, it's the end of June. Gotta get it. You passed your NCLEX. Woo! Yay. Now, Tori Sosa, you do not have to be this petty. You do not have to be that petty. No, ma'am. Oh, that is so funny. All right, y'all please congratulate Gotta Get It. She passed NCLEX, got the results today. What's up, nurse? Gotta Get It. I don't know your name. What's your name? All right. Let me do that. Great job. Oh, I'm finally on time too, girl. So that's what I thought you meant. All right, guys. Welcome. It is NCLEX Jeopardy time. Y'all, first of all, whose first time is it here for NCLEX Jeopardy Thursdays? If it's your first time, please let me know. Okay, please let me know. Chrissy Mill also passed NCLEX. Just do a little dance real quick. I'll just do a little dance real quick in your seat. Something hopefully better than that. But congratulations, everybody. All right, so all my first timers, welcome to NCLEX Jeopardy. I'm so glad that you are now joining me now because we did a little facelift to NCLEX Jeopardy. So now you'll be able to see the questions on the screen, so that while I'm reading them, you can kind of just read along, especially for my visual learners, and I'm a visual learner too. So this will definitely come in handy. All right, so basically our NCLEX Jeopardy is our weekly review where we review NCLEX style questions appropriate for RN and PN. Okay, so it does not matter if you're an RN or PN, you're supposed to be here. Okay, if you're studying for the NCLEX, you're supposed to be here. Okay, so today's categories, this is NCLEX Jeopardy because as you can see on the screen, it's real Jeopardy style blue screen. You have your questions, your categories, your 5 questions, each ranging from 100 to 500 points. And with that being said, we are playing for points. Okay, we're playing for prizes, I should say. The person with the highest score is going to win a free digital Ultimate Nursing School bundle, $97 value, yours for free when you win NCLEX Jeopardy. Okay, our topics, this is the right topics, right? Yep, all right, our topics for this week: fundamentals, pharmacology, dosage calculations, lab values, and med surg. I don't know if you guys came to my my free lab values study hall that I had this past Sunday, but if you were there, then this category, we're about to test you and quiz you on this category, okay? And if you don't really do that well in this category, then join me for this Sunday's part 2 of the lab values. Okay, so I'm going to pick the category. I'm going to put up the questions. It's going to have the answer choices. I'm also going to read it out loud. All right, you guys are going to have about a minute. All right, about a minute to answer. Because this is Jeopardy style, you must say what is when you're inputting your answers. So right here in the comments, when you're ready to answer, put what is and then whatever your answer is. Now, this round, we do have alternate question types as well. We're getting you kind of acclimated to those. So we're going to have some select all that apply. Of course, we're going to have our multiple choice, and we're also going to have a fill in the blank for our math dosage calculations questions. Okay, just getting you kind of prepared for the actual NCLEX as well as the NCLEX style questions that they're going to have, alternate from just multiple choice. Okay, so yes, so if your question is I don't know, it's asking you for multiple choice and your answer is 2, you have to put inside the comments what is 2. Okay, and the first person to correctly answer on my screen is going to be the winner of those points. Okay, just in case there's some lagging going on with Instagram and the live, you can leave the live then come back in just in case. But for all the parts, I want to say for the most part, I'm going to be going off what I see on my screen. It may be different from what you see, just due to like connectivity issues. So maybe somebody, or maybe you answered before somebody else on your screen, but on my screen, I'm going to go by what's on mine. Okay, with that being said, we're just playing for fun. We're playing for prizes. We're playing for incentives. So the whole what is in the Jeopardy aspect is just to make it not look so scary and overwhelming. Okay, it's still NCLEX review. If you get it right, great. Especially if you get it right, but you just don't get it first. No one really cares. As long as you get it right, okay? Because the actual NCLEX is not Jeopardy style. They don't give a shit if you say what is, what isn't, blah, blah, blah. They want you to do these right. They want you to answer the questions incorrectly. So as long as you're doing that and grasping the content, that's all I care about. That's all I care about. But we're just doing it Jeopardy style to make it fun and funky, okay? All right, so let's go ahead and get started, okay? What's gonna be our first category? Let's look and see. Do I want to start off easy or do I want to start off hard? Which one do I want to do? All right, somebody really quick, pick a category. Pick a category really quick. I'll pick the question, just pick the category. Fundies, farm, dosage calc, lab values, or med-surg. What do you guys want to do first? What do you guys want to do first? Go ahead and put it in the comments right here. What category y'all want me to start in? Let me make sure. Oops, wait. Yay! I wasn't seeing a lot of y'all stuff because I was scrolling all the way up. All right, so first person to actually say a category was... They said funds. Fundamentals. All right, so let's go ahead and go to fundamentals. Fundamentals. All right, fundamentals for 300. All right, here we go. The nurse has been giving a client furosemide intravenously for an exacerbation of heart failure. The nurse monitors what potential abnormal blood levels that frequently occur when this medication is administered. Selects all that apply. All right, so 1, serum sodium, 2, serum protein, 3, serum albumin, 4, serum potassium, or 5, or 5 serum creatinine. Remember, this is selects all that apply. And with select all that apply, you can have as little as 1 correct answer out of these choices, or literally all 5. Okay? Sometimes there's 6 options, but in this particular question, it's only 5. So you can have as little as 1 or as many as 5. So which potential abnormal blood levels that frequently occur when you're giving a client furosemide intravenously via the IV, okay? What would occur? What would the nurse need to monitor when that's being administered? All right, so let's go ahead and see what our answer is. All right, our answer is what is 1 and 4? 1 and 4, which was serum sodium and serum potassium. All right. Rationale says serum sodium, potassium, and chloride levels can be affected with the administration of furosemide. What's another name for your furosemide? What's the brand name of furosemide? Mind you, on the NCLEX, only the generic. You're only going to know the generic. They're only going to name or list the generic. But for brand, just know it for you in the real world. Okay. So thank you, Yasm. It is Lasix. So furosemide or Lasix, that is a loop diuretic. All right. And these medications block the sodium potassium chloride co-transporter. Okay, and that's in the nephron of the ascending limb of the loop of Henle. All right, in the kidneys, where most sodium is reabsorbed. Okay, serum protein, albumin, and creatinine levels are not affected with the administration of this medication, which is furosemide. All right, so remember with diuretics, you diurese. So you're going to urinate a lot. Okay, that's how you, it's your water, I wouldn't say pill because this one's done IV, but it's your water drug. Okay, you're going to diurese and excrete lots of water, whether that's via urine. It's usually via urine, actually. All right, so the first person to say 1 and 4, which was serum sodium and potassium. Let's see who that was. I'm going to scroll all the way up on my screen. Don't forget. Yasm 89. Yasm 89. Great job. And congratulations. You are on the scoreboard for 300 points. So Yasm 89. Great job. All right, who else got 1 and 4? Chrissy Milbridge, you didn't say what is, but you got it. Great job. Natural by Nature, gotta get it. Beauty I Am, Brittany, the Nurse Jasmine, Momo, hey Momo, Kiki, Yummy, I Am the Ambitious One, great job. And then everyone that said Lasix, awesome job. Awesome job. All right, great. Let's go ahead and get into our other question. For those of you that got it wrong, just make sure that you read over this rationale and really comprehend it. Okay, so let's go ahead and get into our next question. Let's do pharmacology for 400. Hello, Kiki Ellie, or something like that. What's up? All right, Pharm for 400. The nurse is monitoring a client receiving cyclosporine. Which sign or symptom should indicate to the nurse that the client is experiencing an adverse effect of this medication? 1, nausea. 2, tremors. 3, alopecia. Or 4, hypotension. What is going to be our adverse effect of a client taking cyclosporine? What's going to be? What's the sign or symptom that indicates an adverse effect? What medication is this? 400. Okay, great. All right. So I'm getting lots of 2s, but I'm also getting 4s as well. Okay, so let's go ahead and see what our answer is. What is our answer? All right, and the answer is, drum roll please, what is 2, tremors? What is 2, tremors? All right, so rationale says cyclosporine is an immunosuppressant used for prevention of rejection following allogeneic organ transplantation. Adverse effects of cyclosporine are nephrotoxicity, which is, toxic to the kidneys, infection, hypertension, tremors, and hirsutism. Of these, nephrotoxicity and infection are the most serious. Okay? Did y'all know that cyclosporine was an immunosuppressant? Did y'all know that? Everyone that said, what is 2? Let's look and see who got what is 2 and answered that correctly in first. Who's the first person to get that one? Remember to say what is. D. Durham. Hey, D. Durham. Welcome back. D. Durham. There we go. Underscore. You are on the scoreboard with 400 points. Great job. Who else got what is 2? Bundle of Jazz, Tori Sosa, Miss Nikki, Yasm, Diva Doll. Then a lot of people chose like 4 and 1. Hey, Lauren. Mama said, nope, didn't learn that drug yet. I know, right? So now you know that cyclosporine is immunosuppressant. Okay. Adverse effects, which are different from side effects. Remember, nephrotoxicity, infection, hypertension, tremors, and hirsutism, which means like excess hair. Which is funny because one of the options on the actual question, like number 3, was alopecia. And so the opposite of that was actually hirsutism, which is really an adverse effect. NCLEX in a month. Okay, Unknown Beauty, you got this, girl. Awesome. Okay, great. I'm so glad y'all love seeing the questions now. I'm very happy with this change. All right. Okay, so let's go ahead and get into our next question. We did farm for 4. So let's do, ooh, y'all gonna hate me, but go ahead and get out your calculators. Get out your calculators, your pen, pencil, paper, all that, because we're about to do dosage calculations. We're about to do dosage calculations in 3, 2, 1. Y'all got this though. All right, dosage calc for 200. The child who weighs 17 pounds is to receive 72 milligrams per kilogram per day of a prescribed medication intravenously every 4 hours. I know, I love you so much. I love you so much, Kiki and Melanin K. How many milligrams should the nurse administer to the child in a single dose? 92.64, 139.1, 448.8, or 673.2. Okay, I'm about to say Yasm. That's not an option. It's not an option, but okay, I see you put what is 1. All right, okay. I'm getting ones. I'm getting ones. All right. Are we all wrong or are we all right? Let's look and see. I'm gonna give y'all a couple more seconds. All right, let's look and see what the answer is. What did I say? Dosage calc. What is 1? Look, y'all was sitting right here saying, oh, I came in at a bad time. I'm scared of math. Oh, look at y'all, killing it. Killing it. The correct answer is what is 1? 92.64. 92.64. Lauren said I'm old school. You're so silly. All right, so first things first. You want to convert pounds to kilograms. Let me go into my thing because what's this? Dosage count for 2? Yep. All right, so yes, first things first, you want to convert pounds to kilograms. And you guys know that 1 pound equals 2.2 kilograms. All right, so since we have that conversion, we can go ahead and figure out what our our conversion from pounds to kilograms is. So 17 pounds, divide that by 2.2 kilograms. That's going to give you 7.72 kilograms. Next thing we do, all right, we're going to multiply the prescribed milligrams per day by the child's weight in kilograms. All right, because remember, they're to receive 72 milligrams per kilogram per day. All right, so since we know their weight in kilograms, we're going to multiply that by the dose. So 7.72 times 72 milligrams is going to give you how many milligrams per day they're going to receive. That's going to be 555.84 milligrams per day. But remember, the question said how many milligrams should the nurse administer to the child in a single dose. They didn't say single day, they said dose. All right, so they're supposed to get this med every 4 hours. All right, and if they're supposed to get it every 4 hours, then that means it is given 6 times a day because there's 24 hours in a day. Divided by 4 is 6. Okay, so now for that dose per day, we're going to divide by the number of doses. Remember, it's going to be 6 doses. So 555.84 divided by 6 is going to give you 92.64. And my computer's about to die. 1 second. Wait for it. We're in the game. We're in the money. All right. So yes, it is 92.64. Great job to a lot of y'all got that. A lot of y'all got that. I'm not gonna say I'm impressed. Okay, fine. I'm impressed. I'm not gonna lie. I'm very proud of you guys for getting that one. Okay, first person to get that correct was Yasm89. Yasm, you're already on the scoreboard with 300 points. You just got this one correct. And so now you have 500 points. Great job. Who else got it? Jaqueline, great job. Unknown Beauty, I Am the Ambitious One, Smiles, Mid Amor, Kiki, Modanadine, Bundle of Yaz, Mel B. Lawrence, I didn't even write it out. You got this, girl. All right, so great job. At this point, just take my NCLEX from me. Nah, you got it. I promise. All right, let's go into our next question, guys. That was dosage for 200. So let's do lab values. This is select all that apply. So I love you in advance. But this is lab values for 500. All right. Let's go ahead and read it. A client has a urine specific gravity level of 1.034. The nurse determines that which causes or conditions can be related to this level. Select all that apply. 1. Glycosuria. 2. Albuminuria. I can't say it. 3. Dehydration. 4. Diabetes insipidus. 5. High creatinine level. Or 6, increased blood urea nitrogen or BUN. Remember, this is select all that apply. All right, we have 6 answer choices, which means it can be as little as 1 correct answer or as many as all 6. Okay? So I'm going to give y'all some time to answer that. I'm going to give y'all some time to answer that. A urine-specific gravity level of 1.034. All right. What would be a cause or condition related to this level, 1.034? Hey, APRN boo. Hey. All right, let's look and see if we got it right, who got it right. Let's look and see. Lab values for 500. And drum roll, please. The answer is 1, 2, and 3. 1, 2, and 3. Glycosuria, albuminuria, and dehydration. 1, 2, and 3. All right, so first of all, a urine-specific gravity of 1.034. Is that low, normal, or high? Is that low, normal? Oh, it literally says it. It literally says it. All right, let's just read the rationale. It says, specific gravity evaluates the kidney's ability to regulate fluid balance and the hydration status of the body. A specific gravity level of 1.034 is high. Okay, even better question. Do y'all know what the normal range is? Well, you know that 1.034 is high, so at least that lets me know that y'all kind of know. But if you know it specifically, put it down here in the comments, okay? All right, some causes for high specific gravity levels. All right, they are dehydration, albuminuria, and glycosuria. The BUN and creatinine levels do not evaluate hydration status. 1.01 to 1.030. Absolutely. Great job. Great job. Diabetes insipidus is related to a low specific gravity levels. Okay? Now, quick thing. If you're like me, who like in nursing school, urine specific gravity would for some reason always confuse me. I don't know why, but it would just, I would just get it all the way confused as far as what could be like a cause and stuff like that. So whenever I think of, or whenever I see urine specific gravity and I see a level, I think about the urine concentration, because essentially that's what it is. So urine specific gravity is going to mirror or reflect the concentration of the urine. All right, so if the urine specific gravity is high, that means the concentration of urine is high. All right, so you want to think about causes and conditions that will make that urine very concentrated. All right, dehydration is one of them, which is why dehydration is up there. All right, glycosuria, albuminuria. All right, those are glucose in the urine and albumin in the urine. Okay, and then those are, once again, those are going to affect the hydration status of the body, which is reflected in the concentration of the urine. All right, those are going to be your urine. If you have glycosuria, albuminuria, and if you're dehydrated, your urine's going to be concentrated. AF, AF, AF. Okay, like, I mean, your urine is going to be, I'm trying to find like what color your urine's going to be. I don't have anything like really, really yellow. Like that. That is a concentrated urine, okay? And we know that if you have a dilute urine, then it's going to be like very pale yellow, all that stuff. Like a, thank you, Lauren, thick yellow, and it's probably going to smell like sugary pee. Ew. Okay? So think about that when you have a question about urine specific gravity. Okay, it's going to stink, almost orange, period. Great. You want to think about concentration of urine if you need a little bit more like imagery, I guess, and just imagine and smell that really stank concentrated urine. Okay. All right, next. Did I say who got that? Nope, sure didn't. Let's scroll up. Let's see who got 1, 2, and 3 correct. 1, 2, and 3. Unknown Beauty was the first person to get that one. So great job. And Unknown Beauty, your NCLEX is in a month, which I'm not worried, because you have been coming faithfully to NCLEX Jeopardy for months. You got this in the bag. You got this in the bag. All right, so great job, Unknown. Who else got it? D. Durham. Benta Kib, great job. Awesome. I didn't catch the suffix urea. Awesome. We got some smart nurses in here. Yes, we do. All right. Yeah, these videos are saved. I'm going to start putting them on my YouTube. I'll talk to you guys a little bit more about where these saved videos are going to be a little bit later on this week. All right, so let's go ahead and get into another question. All right, that was lab values for 500. Let's do MedSurg for 100. All right, MedSurg for 100. All right, it reads, the nurse has completed discharge instructions for a client with application of a halo device who sustained a cervical spinal cord injury. Which statement indicates that the client needs further clarification of the instructions? 1, I will use a straw for drinking. 2, I will drive only during the daytime. 3, I will be careful because the device alters balance. Or 4, I will wash the skin daily under the lamb's wool liner of the vest. All right. What is... I'm gonna go back to it because I see we got messing up already. The question states, which statement indicates that the client needs further clarification of the instructions? All right. If somebody needs further clarification of the instructions, it means whatever they're saying is wrong. So you're looking for the wrong answer. Let me just say that. You're looking for the incorrect statement. All right. Don't let those like double negatives, don't let that confuse you. Okay? All right, which statement indicates that the client needs further clarification of the instructions? Need for further teaching. That's basically what that is. All right, let's look and see what that answer is. What is 2? I will drive only during the daytime. I will drive only during the daytime. That is the statement that indicates that this client didn't really get what we were saying just yet. This was incorrect. Okay? So, rationale says the halo device alters balance and can cause fatigue because of its weight. The client should cleanse the skin daily under the vest to protect the skin from ulceration and should avoid the use of powders or lotions. The liner should be changed if odor becomes a problem. Please change it if odor becomes a problem. The client should have food cut into small pieces to facilitate chewing and use a straw for drinking. Pen care is done as instructed. The client cannot drive at all because the device impairs the range of vision. Smile said, first of all, what is a halo device? Damn. Ooh. My computer died, but it don't matter because I got this I got this stuff right here. Let me go back and see who said 2 first. I think I remember, but I'm gonna go. Right, Unknown Beauty. I'm a vet. Period. What is 2? What is 2? Unknown Beauty. Unknown Beauty. All right. So Unknown Beauty, you got 100 points added to your score of 500 points. So now you have 600 points. All right. Yasm, you're right behind her with 500 points. And then D. Durham, right behind her with 400 points. All right. It's still, it can still be anybody's game. We have like 5 more questions. Okay. Who else got what is 2? Bundle of Jazz, Norris Bree, Bentakib, Smiles, Shanice, I'm the ambitious one, Jack the Queen. Should I change my answer? But I have it now. Period. Right. A halo is it literally looks like a halo. I don't know if you ever like seen Grey's Anatomy or something like that, but it's when like somebody said it's an internal fixation device, specifically for when you have like a cervical injury going on. It's like rods and poles, yes, but there's like literally like a circular, I'm not going to use my ring light, but it's like a circular, literally halo right here. And there's like pins to stabilize the cervical region. So it looks like a halo. That's why it's called a halo device. All right. And if you have this big old halo, I wish I could pretend it's a halo. Pretend it's a halo. So if you have a halo and it's like, first of all, this is a C, so shut up. If you have a halo on your, like right here, and it's like, my bad. All right. So if you have, a halo and it's right here, you won't be able to drive because you can't see much. Like it's just all up in your vision. So that's what a halo is. That's as visual as I can make it because I can't find nothing else around besides my ring light, and I need that. Lauren said, if you used your ring like that, that would just confirm you are a nurse and period. Y'all know. All right, let's get into our next question. Right. You can't be doing this with a cervical injury. Be like, hey, you can't do that. All right, you can't do that. All right, let's go into another question, guys. That was Med Surg for 100. Let's get into. Let's start over and do fundamentals, but for 200. Fundies, but for 200. All right. The nurse is teaching a client who had a stroke how to use a walker for ambulation. Which level of prevention is the nurse implementing? This is real throwback fundamentals. All right. 1, basic level. 2, primary level. 3, secondary level. Or 4, tertiary level. What level of prevention is the nurse implementing? Basic, primary, secondary, or tertiary? Oh, we get lots of what is twos. Lots of what twos. All right, let's look and see. It's between 2 and 4. I'm getting lots of 2s, but I'm starting to get lots of 4s too. And then somebody else came in with a 3 to shake it all up. All right, let's look and see what that answer is. All right. What is 4? Tertiary level. What is 4? Tertiary level. All right. The tertiary level is focused on rehabilitation skills. Absolutely. Therefore, teaching a client who had a stroke how to use a walker is a tertiary level of prevention. All right. Now, remember, there are 3 levels: primary, secondary, and tertiary. There is no basic level of prevention. Now, we got a basic, bitch, but we don't got a basic level of prevention. Stop it. All right, let's go. So yes, primary is going to focus on prevention. P for P. Push a P. All right, primary prevention. All right, next one, secondary screening. S for S. S and S. Secondary screening. Primary prevention. PPP. SSS. And then the tertiary is rehab. I wish that one started with a T. Ooh, I wish that one started with a T, but it doesn't. But it is not. All right, so P for primary and prevention. S, secondary screening. All right, that's more so of like diagnostic. Like think about screening tests. So procedures such as vision screening, mammography, or similar screening tests, or like a hearing screening test, those. And then, and then tertiary level is rehabilitation skills. So obviously rehabilitating them back to normal life or what their new normal of life is. All right, and then once again, no basic level of prevention. We got basic bitches, but no basic levels of prevention. Sorry. All right, T for therapy. Ooh, I like that. I like that. All right, P, prevention. Primary prevention, secondary screening, tertiary, what'd you say? Therapy. Therapy / rehab. We're going to say / rehab, but it's going to start with a T. I like that. That's cute. I'm going to write that down. PST. Great. Thanks so much. That was nice. All right. Who got that one first? Who got it first? Who got it? Who got it first? When you're on the phone. What'd I say? Benta Kib. Benta Kib, what's up, what's up? Great job. You're the first person, I forgot how to spell your name. First person to get what is 4. You have 200 points on the scoreboard now. Congrats and welcome. Who else got it? Bundle of Jazz. Unknown Beauty. Love Tynesha. Jacqueline said, what the heck is 4? Yes, so close. Kiki said, I need a review at this point. That's why we're here. That's why we're here. That scared the shit out of me. Yeah, that is why we're here. T for teach, T for therapy. Ooh, I love that. I just love that so much. All right, let's get into our next question. Y'all see how much we're learning at the same time? Even though we may be getting some questions wrong, don't feel bad because I got that question wrong. When I was doing it and I was like, oh, do I know this? I got it super wrong. So don't feel bad if you did not get that one because I didn't get it right, okay? But I bet you if you see it again, you won't get it wrong. You be like, oh, I remember this from NCLEX Jeopardy and Nurse Sam, and you'll go push a P, S for whatever. You can do all that. So proud of y'all. All right, that was fundies for 200. So let's go into our next question, or category, I should say. And it is farm for 500. Farm for 500, guys. All right. The nurse is preparing to administer a vaccine to a pediatric client. What actions are essential for the nurse to perform prior to administering the vaccination? Select all that apply. Select all that apply. So as little as one of these are going to be correct, or as many as all 5. All right. 1, assess for allergies. 2, verify the prescription. 3, obtain an immunization history. 4, obtain the consent from the parents. 5, check the lot number and expiration date. What is our answer? Okay, I'm seeing lots of all the aboves. Now that is bold, but that is an option. I know beauty, there is no 6. I know beauty said 1, 2, 3, 4, 5, and 6, just in case. That's funny. All right, y'all, let's look and see what our answer is. Let's look and see what our answer is. What is all the above? 1, 2, 3, 4, and 5. Ain't no 6, unknown beauty. She said, just in case, all of them, okay? 1, 2, 3, 4, and 5. Unknown beauty just did this. She did. She just all. Okay. All right, so it says the nurse should verify the prescription and then obtain immunization history from the parents to ensure that immunizations are up to date. The nurse should also question the parents about the presence of any allergies in the child because some vaccines contain, listen to me, some vaccines contain components to which the child may be allergic. And did. All right, so with that being said, some vaccines contain components to which the child may be allergic. Quick question for 100 points. Child comes in and, the child comes in about to get the immunizations, but then the parents let you know that the child now has an allergy to eggs. What immunization would they not get? 100 points. I don't care if you say what is. I don't care. You can, you can't, whatever. Just tell me the correct answer. Child comes in allergic to eggs, scrambled, sunny side up, all of it. What immunization can they not get? Okay, D. Durham. Okay. Flu shot. Smiles unknown as told by Lency Latoya. Shanice, great job. Flu shot. If a child, or honestly, if anybody comes in and they have an allergy to eggs, they cannot get the flu shot. Why? Because a flu shot contains like egg protein or something like that. But so if you're allergic to eggs, you cannot get the flu shot because more than likely, if you have an allergic reaction to eggs, because eggs is a component of the flu shot, you will have a reaction to the flu shot. Absolutely. So, thank you. Who said it first? I forgot. Was it D. Durham? It sure is. All right, D. Durham, you had 400 points. So you just got 100 for answering that little bonus question. Thank you so much. Great job. Right, just like shellfish and iodine. And if you have shellfish and iodine, it's not an immunization, but what can't you receive if you have a shellfish and iodine allergy? Let me see if y'all remember this. Let me see. Yeah, what can't you receive? Shellfish and iodine. I want to make sure I said that right. Contrast. Thank you, beautiful Av. Thank you, beautiful Av. Absolutely. IV, I almost said IV dye. Contrast dye, IV contrast, all that. All that. CT, because of the dye. I know what y'all meant. Absolutely. Absolutely. All right, where was I in the thing? All right, so next, the nurse provides information to the parents about the vaccine and obtains consent. The expiration and the lot number, which is located on the medication vial of the vaccine, should be checked before preparing the vaccine for administration. All right, the vaccine is prepared. The nurse prepares the child for the procedure. Good luck with that. I've gotten kicked in the face many times. I don't do peds. Selects an appropriate site and administers the vaccine. Woo! The nurse documents that the vaccine has been administered and provides an updated immunization record to the parents. Then they'll probably give a sticker to the kid or a lollipop, whatever. Depends on if they kicked you in the face or not. Boom. I am Nebis and I am learning tonight. Period. We learn every Thursday. Period. All right, next question. I gave those points, right? I don't know if I did. I did not. So who got this one right first? Let me look. 1, 2, 3, 4, 5. Let's look. 1, 2, 3, 4, 5. I think it was, yep, future ER nurse. Where you at? Congrats. You are on the scoreboard. Future ER nurse. You're on the scoreboard with 500 points. All right. Unknown Beauties in first with 600, and then Yazim, D. Durham, and Future ER Nurse are all tied for second place with 500 points. And then we have Benta Kid with 200. All right, we still got some questions left. Let's get it. You got it right, Future. Well, Future ER Nurse, not Future like Sierra's baby daddy. Let's look. What was this? Farm for 5. Farm for 5. All right, let's do lab values for 300. Lab values for 300. Let's go. All right, the nurse is reviewing the laboratory test results for a client and notes that the serum sodium level is 150 milliequivalents per liter. The nurse understands that this value will be noted in which condition? 1, heart failure. 2, Addison's disease. 3, a severe burn injury. Or 4, adrenal insufficiency. What is our answer? The nurse notes that a serum sodium level of 150 would be noted in which condition? Ooh. This is interesting. All right, lots of people are saying 3, which is a severe burn. I have a couple people saying 1, which is heart failure. Some people say adrenal insufficiency. What's another name for adrenal insufficiency? Okay, let's look and see what our answer is. What was this? Labs for 300. And the answer is, what is 1? Heart failure. What is 1? Heart failure. All right, so first of all, the normal, I was going to ask you, what is the normal level of sodium? But it just says it right here. Ooh, that just pissed me off. All right, whatever. 135 to 145. That is the normal level of sodium. All right, so therefore a sodium level of 150 would indicate hypernatremia. Okay, hyper means more than, in excess. Okay, DJ said, I'm gonna throw the phone. All right, so hypernatremia is noted in conditions such as heart failure, Cushing's disease, dehydration, diabetes insipidus, diaphoresis, diarrhea. There's a lot of dies. There's a lot of dies. Diabetes, diaphoresis, dehydration, diarrhea. There's lots. There's lots of dies here. And hypovolemia, low blood volume. All right, so hyponatremia would actually be noted in the conditions that they mentioned before, which are, hold on one second. Let me go back to it. What was this? Labs for 300. Okay, so the options were heart failure, Addison's disease, a severe burn injury, adrenal insufficiency. So first of all, adrenal insufficiency. Let me go back to my thing. Hello. Okay, sorry. All right, so yes, adrenal insufficiency. That's Addison's disease. That's literally the same thing as Addison's disease. So 2, I think it was. Let me go back to it. Yeah, 2 was Addison's disease, and then 4 was adrenal insufficiency. Same thing. So 2 and 4 are out. All right, now a severe burn injury. Hold on, let me go back to what y'all were saying. Right. Now remember, with someone said burn injuries, I see, got you guys a lot. All right. So you're thinking of hyponatremia. Someone Ash just put water loves salt, and one of the number one besides infection, but one of the number one not complaints, but complications of especially severe burn injuries is dehydration. Remember, all that water. You're going to have dehydration when you have a severe burn injury, okay? And if water follows salt, if you have low water, you're going to have low salt. So hyponatremia. Does that make sense? Okay. Binta Kip said, no, I was seriously confused with this one. I thought HF would be diluted sodium since it is fluid overload. It didn't say. Now, as far as, let me show you about the heart failure. 1 second. What's this? Hypernatremia. We're going to learn today. We all going to learn today. All right. So it says the hypernatremia on presentation for someone with heart failure is almost certainly due to a combination of free water restriction as well as hypotonic urinary losses in response to loop diuretics. That's what that says. Okay. As far as yeah, and then it says retention of sodium and water by the kidneys causes expansion of extracellular fluid volume and peripheral edema. So hypernatremia. Okay, let me look what y'all saying. HF is really fluid overload. Well, in most cases, congestive heart failure. This one doesn't say that it's congestive. Yeah. That's what I would have said. Yeah. I would have said the same thing if it was congestive heart failure, but it's not congestive. It can be heart failure because their ejection fraction is off, you know? So that's what I would have said it for. On the lungs, EC, blah, blah, blah. All right. I'm confusing too. I know. So did I. Don't feel bad. So did I. That's why it's good to have these reviews, especially when it's a group review, because just in case I'm not clear on something and y'all are clear, or vice versa. Y'all have taught me as much as I've taught you. I promise. I promise. So that's why I love these group reviews where if somebody's confused, the other person's a little clear, we just piggyback off each other and we keep it pushing. Okay? All right. So that was, did I say who got that one? No, let me look. Somebody got that. I think it was, hold on. What's the answer to this? 1. Hold on 1 second. Let's look and see what our answer is. D. Durham. Hey, D. Durham. All right, so you had 500, and then this was 300. So, D. Durham, you now have 800 points. Great job. Who else got that one? Latoya Danielle, NC Pink Rose, Nurse Bree. Great job. Awesome job. All right, now let's go into our next question. Our final question. 5 values. Let's do dosage calc for 500. Dosage calc for 500. All right, a client is prescribed metoclopramide 5 milligrams intravenously or via IV. How many milliliters should the nurse administer if the available concentration is 10 milligrams per 2 milliliters? Fill in the blank. This is another one of those alternate question item format things. Fill in the blank or supply answer. Okay. All right, I'm getting what is 1? What is 1? What is 1? All right. All right, let's go ahead and see what the answer is. I'm seeing lots of the same thing. Everyone is saying 1. So let's look and see if we're all right or all wrong. All right, so the answer to this one is, what is 1 milliliter? Great job, everybody. I think everybody got that one. Benta Kib, yes, 1, not 25. I knew what you meant, boo. Not really, I didn't, but I'm glad you corrected it. All right, so yes, 1 milliliter. First person to get that was Candace M. Rasmussen. So great job, Candace. You are now on the scoreboard with 200 points. Great job. All right, so if you did not know how to complete this, in which it looks like everyone did, y'all all put the right answer. So as far as medication calculation, the formula, desired over available times the volume, all right, or desired over what's on hand times the volume. That's going to give you your milliliters per dose. All right, so the question said, and I lost it. That is fine. Fine. 1 second. What was this? Dosage calc? Okay, cool. This is supposed to be dosage calc for 500. So Candace, you actually have 500 points. My bad. I mislabeled it. Okay. All right. So it says that the client is prescribed metoclopramide 5 milligrams. All right. So that's going to be our desired. That's what the doctor desires, or the physician desires for that client to have. It's going to be whatever is being prescribed. So yes, 5 milligrams. Now, as far as how much is available, it says that the available concentration of this medication is 10 milligrams over 2 milliliters. So we just plug and play. We already have our desired for 5 milligrams. And then our milligrams for how much is available is 10 milligrams. And then it's times the volume, which is 2 milliliters. So our complete equation would be 5 milligrams over 10 milligrams times 2 milliliters. All right. Milligrams are going to cancel out. 5 divided by 10 times 2, it's going to be 1 milliliter, which is what y'all got. Great job. All right. Literally everybody got that one. Awesome job. Awesome job. I have been here since last year. I've learned a lot from. I'm about to take that as soon as I love you guys. Stop it. Yes, Lauren and Benta Kib and Unknown Beauty have been coming for like years at this point. Years. And I appreciate and love y'all so much. Oh my God, I cannot. All right, guys. Wait for it. Hold on. All right, that concludes. How do you find the volume of if the volume isn't given? The volume is usually given. It's usually, especially if it's in a concentration, it's whatever the milliliter is going to be, or whatever the volume, yeah, they usually give volume. They usually just really give everything. The only thing that they probably don't do is, if they don't, I think they always give volume. Correct me if I'm wrong, but I think volume is always given. You just have to know that it's volume that's being given. Okay? So the correct, I almost said correct answer. The person that won tonight is, with 800 points, D. Durham. That's my applause. That's my applause from the crowd. So great job, D. Durham. You have won. You are won first place. Really? If you do not have the Ultimate Nursing School Bundle, congratulations. You just won a free digital copy of the 400-page best-selling Ultimate Nursing School Bundle. Absolutely. All right, so woohoo! Go ahead and DM me your full name, first and last, plus your email address so I can go ahead and send that to you so you can get your study on. All right, if you guys want to play the rest of the questions, remember, we had 5 categories, 5 questions each. So we have a total of 25 practice questions for this week. We only did 9. So if you want to play the other 16, make sure you download the NurseAm app, just like right here. It's going to be right here. It's a free app, free to play, all that stuff. So yes, download the app so you can play the other 16 questions, or the total 25 questions, especially if you want to go and refresh your memory, the ones that you got wrong, kind of look at them again and make sure that you really understand the concept and concepts. One second, I'm trying to find. Okay, here we go. Boop. All right, I just wanted to make sure. So I'm gonna go ahead and I'm gonna change the questions from last week. So if you go into the app now, you'll have the questions from the other 25 questions from last week. But remember, you get 25 questions weekly, 25 new questions weekly, to help you with your NCLEX practice. All right, so we go over about like 9 or 10 during our live. And then you guys have the other half, so you can practice on your own time, if you want to practice with a group, however you like to do it. Okay? So, D. Durham, congrats again. Make sure to DM me your information so I can send that out to you. Beautiful app, is the NCLEX Arcade videos available? Yes, so we brought back NCLEX Arcade. If you go to the link in my bio, or go to thenursam.com, you will see the full version of the NCLEX Arcade. So that's going to include all 6 video replays and the 372-page workbook. All right, that's going to include like 200 questions. It's great practice. Ask Lauren. Lauren did it. All right. All right, so remember, I do this every Thursday at 7 p.m. New questions, new chance to review as a group, and all that stuff. All right. Beautiful apps. I have the book, just need the videos. Send me a DM. Send me a DM, because we don't just have the videos. It's either like we just had the workbook or we had both of them. All right. Lauren said, I love Arcade. I'm going to do it all over again. It's answered. It's awesome. What was your question, Celia? Let me look. Lauren really pretty much answered it. What advice would you give someone who's starting nursing school this fall? To start studying for the NCLEX. Start studying for the NCLEX. If you, start coming to NCLEX Jeopardy, especially when we do our fundamentals. If you have, fundamentals is really going to be like one of the first classes that you take, if not the first class that you take, as well as like pharmacology. So if you can get in on some of those reviews, if they're having pharm or fundamental specific reviews, I would get in on that. Especially fundamentals, because going into nursing school is going to be, it's a whole different ball game as far as studying, the workload, the pace. It's just a different ball game. So you want to get as used to and accustomed to it as you can, especially before it actually starts. So use this summer to, yes, relax and do all that great stuff, but still be as prepared as possible. Grab my Ultimate Nursing School Bundle, or grab my first semester bundle. The first semester bundle is within the Ultimate Nursing School Bundle, but just in case you want to like have a lower cost option. If you want to do that, you can grab the first semester. That's going to have everything that you would need during your first semester, to excel in your first semester. Also, just like Lauren said, come to our weekly NCLEX Jeopardy Thursdays, and download the app so you can play the games, so you can play the free questions. Practice, I won't say makes perfect, but it's as close as you're going to get. It's as close as you're going to get. Practice, 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 no matter if you're in your first, second, third, ninth semester. It does not matter. Practice taking those questions, because in those practice questions, that's when you also learn, as evidenced by tonight. Okay? All right, guys. Thank y'all so much. Self-care is important. Thank you, Janaya. Absolutely. All right, so thank y'all so much. I will see y'all next Thursday. All right, and I'm gonna put the link up for Sunday's study bar. We're going to have part 2 of our lab values, our live study hall. So I'll put that up so you guys can have it as well. If you have any questions, y'all know where to find me. Y'all know where to hit me up. Any order questions, send me an email, support@thenursesam.com. Make sure to download this app free. Okay, so you can play the free questions. Thank y'all so much, and I'll see y'all next week.